special things, aren't they? And every one of them is a living organ factory. Within 6 months, parts from genetically engineered animals like those could be available for use in humans. It's a lifeline for some critically ill people who've been waiting years for transplant operations because there aren't enough human donors. But is it right? Amanda Lowndes, you're 16 years old. How long have you been waiting for a new kidney?
3 years, February.
What's it like being on that waiting list?
Horrible. Just asking all the time when's one's going to come in.
How's it affected your life?
Well, just keep prodding on me, and if I didn't, I wouldn't be here now. They have to do it every 4 hours, and it exchanges 7 days.
Every 4 hours you're on dialysis?
Yeah.
What does that do to your life, your social life, your friends?
It's ruined my life. Got no friends now. Can't go out. I'm tied to the house all the time. It's just horrible.
And you can never forget that today might be the day that you might get a kidney.
How? We're saying, is this going to be the day? This bleep going to ever go off?
You carry this bleeper with you all the time?
Yeah, but with us being off the list, we don't carry it now.
Yes, your hospital's just stopped doing transplants, hasn't it? Your hospital is?
The Royal Staffordshire.
The Royal Staffordshire. Let's hope the Royal Staffordshire get their act together and get you on another transplant list very soon. But in the meantime, we're looking at the possibility of not wanting human, or not having to turn to humans to donate their organs. Mike Wrigglesford, you're the Director of Research for some health charities. When do you reckon we'll be able to look to a pig for a kidney or a heart?
Well, the surgeons are saying that they're expecting to do the first transplant from a pig perhaps in the next 6 months. We've had a major report back in March that looked at this whole question. There's another major report that's probably with the Minister for Health now, and I guess after that it could be any time.
The demand is there, obviously. I mean, there are thousands of people who want transplants. Do you think that it is likely to become anything more than a one-off experiment? Can you see it becoming routine?
I don't think anybody would be looking into this area if it was just going to be a one-off experiment. There are thousands and thousands of people who could be treated with transplants that die every day, every year in this country.
Amanda, how would you feel if your bleeper went and they said, there is a kidney for you, it's from a pig?
I'd accept it. As long as it was a good match, I'd go for it. As long as it keeps me alive.
As long as it keeps you alive. Neil Lea, welcome to Central Weekend. You are also in trouble with your kidneys.
Yeah.
You may one day be in great need of a kidney yourself. Would you say yes to a kidney from a pig?
I've already turned it down.
You've turned down a human transplant?
Turned down a pig's transplant.
You've turned down a pig transplant? Who offered you a pig?
My local doctor, who said that within 2 years he'd be coming to me and saying he'd be offering me a pig's kidney. And I said, well, don't bother, I won't be taking one.
Why?
Because I don't believe in using humans to keep me alive. I'm a vegan, been a vegan for 6 years. That means I don't believe in using animals for any form.
Neil, you're talking about your life here. This could make all the difference to how long you go on for.
My ethics, my morals say that I'm willing to die. If it was the doctors turn around to me and say I can't stay on dialysis or I can't have a human transplant, I wouldn't take the pig one. I would die first. That's my morals. That's my beliefs.
Vicky Cowell, your daughter Laura, pretty young girl, I've just said hello to her, 11 years old, but she's got cystic fibrosis. Would a transplant make a big difference to her life?
It could save her life one day. It's as simple as that.
What would she need?
Heart, lung.
If it was from an animal, would you say yes?
I would.
What do you think about Neil's stand?
I respect his stand very much. I think it's his life and it's down to him what he does with it. I don't agree necessarily, but I do respect him. What I think is dangerous, though, is if people are going to try and ban it outright tomorrow, because nobody has a right to do that. If Neil is saying he will not accept one for him, that is fair. He can't, though, say Laura's not allowed to have one or Amanda can't have one. I think it's got to be down. What about the rights of the humans, for goodness sake? Come on, it's got to be more important.
Toni Vernelli, your husband Grant is very ill at the moment. He's had one kidney donated by his father, I understand. That's failing, and he's in desperate need for another. You really are at the 11th hour, aren't you, and the rest? Are you going to say yes to a pig if it's offered?
No, absolutely not. After seeing the pain and suffering that my husband has gone through, the years of not knowing, the years of you know, tragedy. I mean, it really is a tragedy. What this family's going through is a tragedy, and the same with the woman in the front row. It's terrible. But to purposely inflict that same pain and suffering on other living beings, on thousands of other living beings, I mean, that's just sadistic. We don't have the right to be doing it. And
now,
it
you probably don't eat bacon for breakfast or wear leather shoes.
No.
And that's your choice. You don't inflict that way of life on anybody else. Would you deny the chance here of a transplant from a pig?
Well, yes, and the reason is because as society as a whole, if we go along with these and we don't question it ethically, then we're just paving the path. I mean, there used to be a time when they used orphans. There was a time when they used mentally retarded people and slaves for vivisection. And we said, no, that's wrong.
You would deny, Laura, young Laura, a new life.
Animals love their lives. Animals love their young.
I'm sorry, ethically, I think it would be ethically and morally wrong to deny a child.
This isn't an opportunity for life. It's prolonging their suffering. No one who's had a xenotransplant has lived more than 9 months. They've killed 33 people and thousands of animals in this Frankenstein science.
People are dying every day without any transplant.
Yes,
we
and
live in a
so far,
society.
this hasn't solved their problem. There are 2,000 more organ donors a year in the UK would solve this problem, and only 18.
No,
I think that
It certainly wouldn't solve the whole problem.
Would be absurd.
What would you put your money on for the chances of survival in 2 or 3 years' time when these things might have become more routine?
Well, I'm a heart and lung surgeon, as you know, and a heart and lung transplant surgeon. And the issue of there being enough potential human donors is just not the case. There just simply aren't sufficient human donors. Even if we tap the whole potential donor population, there just aren't enough to treat.
Not enough of us are dying to fill the need.
Not provide suitable organs for transplantation, no.
So if
300 people on the heart list waiting for new hearts. So you're saying there's only 300 hearts for all the people that are dying every year?
Neil, that's just not true, actually. There are 300 heart transplants performed each year in this country. At least 25% of patients waiting for heart transplantation die. And the simple fact is that we restrict the number of patients going onto the transplant waiting list so that we don't have that element of people suffering.
What is the number that on the waiting list?
The potential, the British Cardiac Society worked out the potential number of recipients each year in this country who would benefit from heart transplantation would be between 2,000 and 3,000 a year.
2,000 and 3,000 a year is a lot of people. It's a lot of people. I want to introduce you to Doreen, because Doreen actually has leapt to this moral divide, and because she actually has got part of an animal inside her.
That's right.
What have you got?
I've got a cow's vein grafted into my leg.
Why did you have a cow's vein grafted into your leg?
Well, in the early 1970s, I went into renal failure, needed dialysis. The routine is that you dialyse through your own veins. My veins kept collapsing, and as a last resort, they said we'd have to graft a cow's vein into your leg. If not, you wouldn't be able to dialyse. Without dialysis, I was going to die. I got a 5-year-old son. Now, I think he had a right for his mum to live. I think he had a right to have a mum.
The animals have a right to live too, don't they?
Would you have denied, Zav Phipps, you're an animal rights campaigner, but you are really looking here at the sharp end of decision making. Would you have said, no, she shouldn't have had that?
No, I did, but I think you're asking the wrong question. It's not a question of whether we should be using cows and pigs. It's a question of why aren't there enough donors? I mean, surely, and it's a shocking. Hang on,
Zab,
it's a
we've just
shocking
had the
and
answer,
disgusting
because not
indictment.
enough people die.
Oh no, come on, that's not the good. If more people carry the donor card, so we have to kill animals instead. Is that the answer? I mean, no, I don't think it is. She's talking about, well, 2,000 people die a year on the waiting list. Okay, but millions of animals are killed for no reason. We don't need to kill animals. We don't need to enslave animals for food. And for us to evolve any further, we have to see that we cannot do this any longer.
Society,
we cannot evolve further.
Is this the brain?
Decisions for these people to make for themselves personally. But the fact is, we live in a society that eats animals, it wears them as clothing, it uses them for entertainment, as pets, and animals have been used in medical research which have developed things like the ability to do transplants, blood transfusions, vaccines, anaesthetics. We simply would not have those things if it hadn't been for animal experimentation.
Okay, listen,
and in that circumstance, it is amongst all the other routes we're looking at, we have got to look at animals as possible organisms.
Andrew, let me introduce you to Andrew over here. Andrew, your son Daniel sadly didn't survive a heart transplant.
No, it was too late.
It was too late. They got the heart from Barcelona, I understand.
Yeah.
And they put it in.
Yeah, it was put in. It was fine. But after the amount of time we waited, it was too late.
How long did you have to wait?
6 weeks.
And during that 6 weeks, would you have considered a peg?
I actually asked for a pig's heart.
What did they tell you?
It'd be too long. It wouldn't be ready in time.
I mean, you're talking years of research.
I mean, don't get me wrong. I respect these people's beliefs. At the end of the day, my son's life came first.
His
short of murder, I would have done anything.
Really? You would have killed the pig?
I would have killed the pig, took the heart out, put it in myself.
Mike, beyond that, there is this problem that we have faced with various other things in the recent past. We have AIDS that we think may have leapt from the animal chain. We have mad cow disease that we think may have leapt from the animal chain. We mess with animals at our peril. We don't really know what viruses we're going to let out.
Well, that's a very alarmist view. I mean, the expert reports who've looked at this have said there is a risk. It would be crazy to pretend that there wasn't a risk, but the risk is minimal. In other words, viruses...
A virus only needs, as far as I know, a minimal
viruses
space.
we can detect, probably. So the person that it's going to be a danger to, if there is that one-off case, and there may well be, is going to be the person who receives the transplant. It's not going to be a mass epidemic that's going to sweep the population.
At the beginning,
this is absolute alarmist nonsense.
It's alarmist nonsense, you're scaremongering.
We've already seen the polio vaccine contaminated with the SP40 virus, which lived quite happily in the green monkey, and then when it got into human beings, it caused cancer. We've got HIV, we've got house, which can live with viruses. Once you start taking them out, you've got all kinds of problems. We have enough medically induced plagues as it is. We don't need to create any more.
Is this true? Yeah. Is this true? Are we right to... Would it be right to be much more cautious?
I think it's right to question it, but I think the caution's already being taken. We know so that the work that's been done experimentally on xenografts, a lot of it is concentrated on eliminating the risk of infection into humans. I think that the main risk, of course, is to the person receiving the transplant, and you have to balance that against the risk of them not having it.
Let me ask Vicky. Vicky, are you prepared to take that risk with Laura?
When we're far enough down the line, yes, absolutely. If it was a matter of life or death, if she was going to be dead in 6 months' time, I think it's a risk you've got to take. Yeah. You've got to.
And what I'd like to know, these people, I know they have the views, but have they ever sat at the side of a bed and watched a child go...
Lady here has had her hand up for a long time. Tony, thank you very much. This lady here has had her hand up for a long time.
I've got a son who happens to have Down syndrome. Now, funnily enough, Down syndrome people aren't considered worthy to have heart and lung transplants. There's a girl dying because she can't have a heart and lung transplant. So in some ways, Down syndrome kids are regarded as subhuman. Now, I would quite happily donate his kidneys if a healthy pig that was a perfectly normal, healthy pig...
child!
He is not considered human. We've already said that. If he was ill, he wouldn't get heart transplants. He's not worthy because he has Down syndrome. That's society's idea of him. He also won't refuse. He won't say no because he has no voice. It's exactly the same with the pigs. The pigs have no voice. So because the pig has no voice, and you're stronger than the pig, do you say...
Okay. Thank you very much. Thank you, madam.
Actually fit to live. He is not fit to live. He will always be a burden on society.
Thank you, madam. Thank you very much indeed. Excuse me. Let me reach out to you. We've got his picture here. He's a gorgeous boy. You should be proud of him.
I have to speak for him. I also have to speak for the pig and every other animal that you're going to kill and destroy. What's it going to be next? Chimpanzees? What else are you going to pick on that hasn't got a voice?
Society is getting sicker all the time, and it's time that we started sorting out society, making it the kind and compassionate place we want it to be.
And that would include Andrew. Zab, now listen, this is a very passionate voice. This is a very... Zab.
Shocking indictment on the British government that
Zab, thank you very much indeed. When you hear the feelings that come from the bottom of somebody's soul like that, these are feelings that are profoundly meant. Do you think it is very cavalier of the drug companies and the medical researchers just to carry on without taking it very seriously and addressing these arguments?
Well, it is taken very seriously, and these arguments are being and have been addressed, and are being addressed here. That's why we're doing this. But I would like to say that the level of animal husbandry now, and particularly for transgenic pigs, I mean, this is so much. It has improved enormously over the thousands of years. I mean, you know.
We've got to wind it up now. I want to talk a little bit to Amanda. Amanda, you're going to be 17 tomorrow.
Yeah.
I don't think there'd be any prizes for guessing what your birthday present in its ideal world would be, would it?
And she's entitled to it, isn't she?
You want that bleeper to go. You want a kidney. Now, this is an argument that will rage for a long time, and we haven't had the first animal organ transplant yet. In the meantime, what do we do to help the thousands like her?
We all carry a donor card.
Yeah.
If tragedy does occur, if a tragedy in your family does occur, and your loved one becomes a potential donor, then you say yes.
We'll all say yes, if it's us. Thank you very much indeed. Thank you.
I was